Hello, welcome to the orthodontics section. Orthodontics for children is divided into Phase 1 and Phase 2. Phase 1 is treatment up to the time before all the permanent teeth have erupted, and Phase 2 is treatment after the permanent teeth have come through and is generally when we place braces. Normally, orthodontics for children starts at about 8 to 10 years of age, but can start earlier depending on the specific conditions and the dental development of the child. Basically, what we have is a top and bottom jaw. Sometimes either one is too far forward and sometimes one is too far back, and sometimes there's a bit of both. Then there are these little things called teeth. Sometimes there's enough room for them and sometimes they all come out crowded. So in Phase 1 we try to get the jaw aligned as much as possible, and we try and make either some space for the teeth by expanding the mouth, or we decide to take some teeth out. Generally we use a variety of plates, either removable or cemented, up until the permanent teeth have erupted. This is the end of Phase 1 and the beginning of Phase 2. So Phase 1 is to get as much done as possible before we put the braces on in Phase 2. Braces are normally in place for between 1 to 2 years. They can be metal or porcelain for the more cosmetic look. Adult orthodontics is very popular and accounts for about 40% of all orthodontics done today. Today, instead of using braces, we mostly use a system called Invisalign. It uses a sequential number of clear see-through plastic aligners that straighten teeth without braces. The advantage of Invisalign over normal braces is that they are removed for eating and cleaning and are practically invisible to the naked eye. Invisalign has a fantastic diagnostic system called a ClinCheck. We send photographs and models to Invisalign, and within 2 weeks we get a 3D generated model of your teeth, showing how your teeth will move, so we get to see the final outcome on computer before you've had the treatment, and it also tells us exactly how long your treatment will take. Invisalign has also brought out Invisalign Teen. These aligners have to be worn for 22 hours a day, and so parents have to be sure that their teenagers will wear them. Basically, if they're not worn, they won't work. But if worn, they work very predictably, and we get a great result without anyone knowing you're having orthodontic treatment.